Thank you, Madam Chairman. I'm glad we're holding another hearing to update us on the status of COVID-19 response. And to our witnesses, thank you for the work you've done. More importantly, welcome back to the committee. It's been almost 18 months since the initial reports of severe pneumonia in Wuhan, China surfaced. Since that time, we've tragically seen over 500,000 deaths in this country from COVID-19. Government-backed shutdowns have jeopardized the livelihood of millions of Americans, and we've spent more taxpayer money than I could have ever imagined in response to this virus and the devastating effect it's had on our economy. But now, more than ever, there's reason for hope. We're seeing the promise of vaccines and treatments in real time. A month ago, the case count in the United States was over 70,000 new cases per day. Today, we're down to roughly 40,000 and headed south. CDC is projecting continued declines in death and hospitalization rates. Because of Operation Warp Speed, Dr. Marks, Dr. Fauci, Dr. Hahn, the FDA, we've fully vaccinated 115 million Americans with roughly 44%, which is roughly 44% of adults, and delivered almost 330 million doses to states. Operation Warp Speed and BARDA spent more than $18 billion to make vaccines available to Americans, manufacturing vaccines at risk, and the American people are benefiting from that today. Manufacturers were able to produce enough vaccines that the United States is now able to help provide vaccines to countries in need like India. Because of the collaborative efforts over the last year, we're ready to turn the corner. The partnerships developing and manufacturing the COVID-19 vaccines have been one of the biggest scientific success stories in generations. Industry answered the call at the start of the pandemic and partnered in an unprecedented way to bring us these life-saving products. Intellectual property is part of the reason we have these life-saving products today. If these protections are not in place for innovators of life-saving medicines, we'll not have them for the next pandemic. It's that simple. We held a hearing on the threat of China taking intellectual property from U.S. research, and now the Biden administration has agreed just to hand it over. There's a way to support the manufacturing of vaccines globally and to help countries in need without acting in bad faith against innovators who stepped up when the world needed them the most. It's the partnership we're already seeing today that are saving lives, not silly ideas about socializing means of production. The action from the Biden administration to support waiving intellectual property rights will undermine the innovation we're relying on to bring this pandemic to an end and will leave us with a less prepared future. I'm encouraged that some of our European allies cautioned against this reckless action, and I hope the adults in the Biden administration will realize that what sounds good in a grad school ivory tower thesis paper does not make sense in the real world. You four are the adults in the room. I urge you to think about the real consequences if we just give away this science and this technology. The next part of our job is going to be the difficult part. I've been looking to Israel to help predict the challenges that we may be in store with in the U.S., since they're ahead of us on vaccination rates today. Israel was able to vaccinate 40% of the adult population by the end of February. Their data shows that uptake stalled once they vaccinated about 60% of the adult population. While there are differences between our countries, we have to use the information we've got to best predict our road ahead. Every adult has the opportunity to be vaccinated, and supply is starting to exceed demand. In other words, we have more shots than we have arms to put it in. We need to address vaccine hesitancy, and it needs to be done now. I know this is the case in my state with recent reports from Wilmington, North Carolina, that local officials are changing their approach as vaccine demand slow. We must paint a picture for the American people showing the benefits of both a vaccination and a reopening of our country. This is a simple message for those in leadership positions. I got the vaccine, my wife got the vaccine, my sons got the vaccine, their wives got the vaccine. I've encouraged all my staff to take it as soon as it's available to them, and I've gone through the last 24 hours with a real fear that I had a 1.5-year-old grandson who might have had COVID. Fortunately, it all came back negative, and he'll hopefully leave the hospital sometime today. But I would guess that everyone in this room is vaccinated, which means if we follow the CDC guidelines, we can dispense with masks and social distancing. Tomorrow, I hope that we're going to have a vaccine that's approved for kids over 12 and one's younger, hopefully in the not too distant future. We must reassure Americans that COVID vaccines are safe. Vaccines save lives. I might have been naive when we started this, believing that staying out of the hospital and not dying might have been motivation enough to get people vaccinated. It clearly wasn't. And that's why we must reassure Americans that if you get a COVID vaccine, our lives can and will return to normal. But we can't assure, without painting that picture for them, what that looks like. Today's response is preparing us for tomorrow's threat. As Senator Murray said, we've launched a joint effort to strengthen our public health preparedness programs for the next threat, which we will inevitably face. That threat could be emerging today, or it could be a new virus, another curveball from Mother Nature, or the result of deliberate man-made attacks on our country. Our framework has always been flexible, and it needs to stay that way. There will always be lessons that we learn from each response, and our threat landscape is constantly evolving. Our experience with this pandemic has made that even more clear. Senator Murray and I look forward to working with each of you and the members of the committee on this project to take stock of lessons learned and to actually put them into action. Today, to our witnesses today, thank you for all you've done up to this point of the response, but know that the most challenging days may be the next several weeks and months ahead as we attempt to get to a vaccination level that changes the glide path to one that's permanently in the decline. With that, I thank the chair.